When it's time to do your bowel cancer screening test, you'll get a kit through the post. It can spot the early signs of bowel cancer and it saves lives. In the kit, there's a small stick which is used to collect a sample of poo. The lab checks for any traces of blood in the poo, which is sometimes a sign of cancer. On the day you do the test, write the date on the tube. Check your letter for full instructions on how to label the tube. To take the sample, you'll need to put a plastic tub and a few layers of toilet paper into the toilet to catch the poo. And then you just do your business. Then, using the stick from the kit, scrape a bit of poo onto the end of the stick, making sure the 2 holes are covered. Put the stick back into the tube and twist it to close. The tube goes into the envelope provided and into the post. Be sure to send it back as soon as possible and you'll get the results back within 2 weeks. If there's any trace of blood detected, it could be a number of things, not just the early signs of bowel cancer. The letter will explain the results and if you need to do anything next. For more information about bowel cancer screening, go to cruk.org/bowel-screening.